Okay guys, I'm going to show you how to use the Autoject 2 and how to determine what depth you need to set the tip to. So with the Autoject, you get all of these items right here. You get the base that actually injects the insulin. It has a spring in here. So when you hit the button, it actually pushes the needle into the skin and also inserts the insulin. You have the shaft that screws on, and then you have the tips for different depths depending on not only how long of a needle that you use, but also what size barrel syringe, which is super important. So smaller syringes that hold, say this is a U100 that holds 30 units, it's going to be shorter than a 50 unit syringe U100. As you can see, there is a height difference there. So every syringe, you need to double check your depth on it and just make sure that you still have the proper setting. Even if you change brands, they can still be longer or shorter. So always double check that. So the first thing that you do is you're going to screw this short tip onto the shaft. You're going to screw it down. So these do have numbers or letters for depth settings on here. However, again, with different brands of syringes, different size needles, and different unit capacities, the guide here will not be relevant to anyone in the group. You always need to measure and check it on your own. So I'm going to start with this U40. It's for vet cylinder can insulin syringe. It holds 12 units, and it is a 1/2 inch tip on it, a syringe tip. So the first thing you're going to do is you're going to insert it into the shaft. The shaft has a little spring in it. So you want to insert the needle, and it's going to drop, and you can see how the little T where you grip it with your fingers sits flush and directly against the white spring at the base of this. And then the next thing you're going to do is you're just going to push in on the plunger. And what that's going to do is it's going to show the needle how far it's going to come out of the tip and into your pup. So determine if this is the right depth or not. You're going to push it so you expose the needle. You're going to take this little yellow device, the end that has the notch out of it, you're going to set that on the corner, just like so. And then it will actually give you how many millimeters is coming out. So for this one, we have 8 millimeters going into the pup's skin. So for that particular syringe, I have screwed this as far down as it will go. Okay. So for this one, this is a U40 50 unit syringe. You're going to do the same thing. Put it in, push down. You see now how it exposes not only the needle, but also the base of the syringe, which we don't want to happen. So we need to adjust this depth up. So I'm going to drop the syringe out. I don't want to stab myself. Twist a few times, and you just have to guess at it and just keep going. Still not enough. See that? We are almost there. There we go. And then you'll take your little gauge, see if that's far enough. If so, good to go. You never have to readjust this again unless you check your syringe one day and you see that the length of it has changed. And then the same for a 30 unit. I don't have any 1 mil units here that hold 100 units, but you'll do the same process. With this one, I got to screw it all the way down so that it pops out. And for that one, you can see it goes all the way down in order to get the right needle length. Okay. So once you determine how deep you need to adjust this guide for, you are ready to go. So the first thing you're going to do You're going to insert this into the tip, hold this, put yellow to yellow, push down until it clicks, and it won't go any further. And now that yellow tab that was at the top is pushed all the way into the bottom, because that is what actually triggers and pushes the syringe plunger to disperse the insulin. So now you have this red indicator. Push it down, it's ready to engage. Push it down, hit the button, it will release. So we're just gonna go ahead and load it. Okay. Remove this out of the tip. Don't twist it. As you can see, I twisted it and it moved my gauge. Don't twist it. Pull it straight up and out. Insert your filled syringe. Let's say we're gonna give, let's see. We're going to give 12 units of Vetsolin. You're going to put your syringe in. Don't push down on the plunger. At this point, now that you have insulin in your syringe, you don't push on the plunger whatsoever. You just set it in here. And again, make sure it's flush right there. Sometimes there's little ridges in here that has a spring, and it might, like the edge of the syringe might get caught. If it's not sitting flush like that, it's not loaded properly. Then you'll take the base, you're going to screw it on. You don't have to push down, you don't have to apply any pressure, just screw it on. Gravity does its job there. Screw it tight, and at that point you're ready to go. During this function, it doesn't release any insulin. So then you'll take your pup. I don't have any stuffed animals, I don't have any kids, so we're going to use my dog's toy here. You're going to take your pup, tenants. You're going to do your tent. You're going to press down. And this is the part of the Autoject that may confuse some people. If you don't put any pressure, you see it won't engage. I'm pressing it, it's not engaging. There's that red indicator right there. You have to push down a tiny bit of pressure to remove that red. And then it allows you, let me make sure I don't stick myself, to then disperse the insulin. And you can see after I hit that button, we had that little that little yellow indicator with the lines to show that it's injected all the insulin. Pull it straight out. At this point, you can see the needle is out of the device. It stays out until you actually take the syringe out. So always be careful, and you always want to pull it straight out, not at a curve, not at a side, because you're going to bend the needle and hurt your baby. Next step, you just unscrew it like a bottle top. Syringe comes right out.